All right, in this video, I'm going to show you how to change out the center polarizer assembly. Typically, it's for the DL100s, but occasionally needed for the Carbon. Unfortunately, with these dermatoscopes, if you happen to drop them and drop them pretty hard, especially on a floor like in the typical clinic, these tend to pop out. And if they simply pop out and nothing breaks, then no big deal. But if they do pop out and any part of this ring gets damaged, then unfortunately, yes, it can require replacement. So let me say first, do this with gloves. Don't do this like I'm doing here, because when you do it without gloves, you will get some of the skin oils on this. So go ahead and put some gloves on. But for demonstration purposes, I'm not using any at the moment. First, when you get these two pieces, notice that there's a little groove on either side of the lens. That groove, that little notch, there are two of them equally on either side. So you want to insert the lens inside and find that groove. You'll know it because, again, with gloves on, when you try to twist it, you'll notice that the lens does not move. It's being held in place. And you'll also know that it's being seated properly. Because if it's not seated all the way, there's not going to be enough flex in the end here, which needs to slightly compress in order to actually insert this into the dermatoscope. So what I recommend is once the lens is seated in place within those notches on either side, hold the unit like this. Your fingers, that way you're leaving this edge exposed because that's what's going to insert. And then you can take that, and what I would recommend is just gently move it around. Don't force it, because you will find that there it is. Yep. Hover it over the ring, and then as you move it around with applying gentle pressure, you'll feel where it starts to insert without much effort, okay? And then you'll press it in, and then in doing so, that outer lip, which compresses, is going to push in and kind of rebound and hold the ring in place. So now it is in place. You'll see when I try to move it, it doesn't move and it doesn't fall out. Okay, so that does it. Again, use gloves when you do this, because I can already see that I've left some skin oil marks on the lens, but again, for the purpose of demonstration here of how to do it, I just didn't want to put gloves on. And just a recommendation, anyone who's watching this, considering ordering one, you might want to consider order a couple. I mean, they're not very expensive at all. And if you've ever experienced this problem in the clinic, then you know that when this pops out and it doesn't stay in place, it can be a real hassle and put you without your DL100 for a while. So just order however many you want, but I would recommend order 2 or 3 just to keep on hand as extras, because you never know when, unfortunately, you might drop your light and have this pop out and need to be replaced. Thanks.